Hi, my name is Dr. Kerry Topouzian, and you're watching Ask Dr. T. Hi, I'm Dr. Kerry Topouzian, and you're watching Ask Dr. T. Hi, I'm Dr. Kerry Topouzian, and you're watching Ask Dr. T. Hi, my name is Dr. Kerry Topouzian, and you're watching Ask Dr. T. Today we're going to talk about rheumatoid arthritis. It's a type of arthritis that is an autoimmune condition. So if you have this or have been diagnosed with it, you have to ask yourself, why do I have this autoimmune condition? Why is my body attacking these joints? And some of the common causes can be an infectious process or a food sensitivity or some type of environmental toxin that is injuring the joint, causing your body to have an autoimmune reaction to it. So if you're having joint pain and if it's in your hands and you're going to be tested for rheumatoid arthritis, some of the key labs to have done are a rheumatoid factor, an ANA, a anti-CCP. You should also be tested for gluten sensitivity or wheat sensitivity. Food allergies would be also another good test to have done. You should also be tested for hepatitis C because unfortunately people that have rheumatoid arthritis can have hepatitis C as well. It's a good test to check for. These are tests that your doctor would have to run for you. Also, if you're having any digestive issues or gut problems, it might be a good idea to check out to see if you have any inflammatory conditions in your digestive system. There are different tests that can be done for this. One is called a GIFX, which is performed by Diagnostics. And then there's some alternative treatments that can be used for the treatment of rheumatoid arthritis. One of them is the use of low-dose naltrexone, which is a compounded prescription that you would only be able to get from your physician. And as they say on the commercials, ask your doctor if low-dose naltrexone is right for you. Some other treatments worth considering are actually using Cleocin T, which is clindamycin phosphate. It's a prescription. It's used for acne, but when you use it topically on the joint that's giving you the problem, it may take the pain away and cause improvement. So if this happens, you have to ask yourself, why is an antibiotic improving my arthritis? And the reason would be is because the cause of it is an infectious process. If that happens, you may want to consider seeing if your physician will try you on a therapeutic dose or therapeutic probe of an antibiotic for treatment of an infection. A common infectious agent that can cause rheumatoid arthritis is called Mycoplasma pneumonia. Yes, pneumonia, but it's not actually in your lungs, it's in your joint. Another important treatment would be to try going gluten-free for 2 to 4 weeks to see if there's improvement in the inflammation and pain in the joints. And of course, depending on your testing, if you do have certain food allergies or other food allergies, you would try stopping those foods to see if there was an improvement in your condition. One supplement that may be helpful is called wobenzyme, which is a type of proteolytic enzyme. And there are other proteolytic enzymes out there too that you could take. You take these on an empty stomach, and what they do is they get into your bloodstream and they start digesting the proteins that are floating around your blood. These proteins can cause an autoimmune or inflammatory reaction, so what you're trying to do is treat the underlying cause of the problem. So in summary, some ideas for treatment would be going gluten-free, staying off of other foods that you end up being allergic to, low-dose naltrexone, Cleocin T topically, and then maybe considering taking antibiotics by mouth to see if this helps the problem. Again, ask your doctor about all these things and only do this with the help or partnership of your physician. Okay, any questions out there on rheumatoid arthritis? Well, if you do have a question, you can email me at askdrt@gmail.com. You can also check us out on our website, www.askfordrt.com. And for you history buffs out there, there's a great historical novel that I wrote. It's called A Perfect Armenian. The website for that is www.aperfectarmenia.com, and it's available on Amazon, either on Kindle or hard copy. It's also going to be available on Audible pretty soon. My name's Dr. Kerry Tapuzzi, and you've been watching Ask Dr. T.